Hello students, we'll have an idea about on-table finding today. Just see what is this on-table finding. On-table means during laparotomy, during surgery, when you open the abdomen, what it looks like. That is called on-table finding. So just see what is this on-table finding. See that laparotomy open, abdomen is opened through the lengthy incision. You can see that white jelly-like fluid, not small quantity, large quantity, like apple jelly it is. So we feel like eating it. So that is a very big quantity we had. This one so big. And so what is this entity? So this is the typical Pseudomyxoma peritonei. You might have heard about it. The myxomatous tissues like this whitish jelly-like fluid occurs in many conditions, mainly in peritoneal carcinomatosis and disseminal peritoneal adenomycosis. Peritoneal mucinous carcinomatosis is a very common cause. It may be intermediate discordant. The important thing is they come with a vague abdomen pain, often difficult to diagnose. So they think it is gastritis or something, and they'll keep on taking medicines from different people without getting evaluated by any imaging. So imaging usually gives a diagnosis. They lose weight, they'll be cachexic because their protein deficiency will occur. Their weight loss is very, very typical, and eventually they go for internal obstruction. If you examine such patient, fullness will be there, vague mass will be able to see, dullness in the flank, and shifting dullness is not shift actually because a jelly-like fluid difficult to shift also. Dullness in the flank which is not shift also. Such again dullness in the flank which is not shifting. One more condition we have to remember is abdominal tuberculosis, because loculated ascites when it is there. In case of abdominal tuberculosis, when they present as ascites which is loculated, then flank will be dull, but you won't be able to elicit the shifting dullness because fluid won't move because it's loculated. Same thing happens here because jelly like that, it won't be able to move that easily. So dullness in the flank, but it won't shift. So this is very typical. Often it's called as vague mass or mental cake because everything is involved. So that is the typical look of this. So the look very, very typical Pseudomyxoma peritonei. So dullness not shifting, all that told. CT abdomen, CT guided aspiration, and peritoneal biopsy, tumor markers, so tissue guide, CT guided biopsy of the tumor tissue itself can do, and the tumor marker you will be able to get the diagnosis. Then treatment is appendectomy or right hemicolectomy, then cytoreduction surgeries. That is important, CRS. Now commonly done it is with the hyperthermic intraperitoneal chemotherapy, sugar baker technique, HIPEC. You know that how exactly you do that, open the abdomen. Then after doing cytoreduction, cytoreduction meaning in different regions you remove peritoneum, small second nodules are there, everything clear over the cirrhosis of the bowel. Entire peritoneum has to be peeled off. That is called cytoreduction. It takes usually many hours. And once you do that, same thing you can do the hyperthermic intraperitoneal chemotherapy, HIPEC. That is with the warm temperature, chemotherapeutic agent is instilled into the abdomen. It should be warm. It continuously cycles there, and through the pressure pump are there, HIPEC machines are there. Through the machine it is, because you have to put the abdominal retractors with the often sutures and retract adequately and retract like this and put it. Self-retaining such retractors are available for that specific purpose. Then pour it this one, keep it for 40 minutes to 1 hour. So this warmed one, hyperthermic, that's why warm, usually around 42 degrees centigrade, and that will float there and kill all retained malignant cells inside the peritoneal cavity with the chemotherapeutic agent within that solution, warm solution. So that is the exact meaning of that. It is on-table method. Often it is started by sugar baker. That's what is called as sugar baker technique. Cytoreduction surgery with HIPEC. That is the exact meaning. So you can please go through my manual of surgery. It has given different regions, a technical aspect, everything to understand that. Maybe a MCQ question, the recent one of course, MCQ question or short note may be asked, Viva they may ask, Oxy they may ask, what is HIPEC, what is cytoreduction surgery. So SRB's manual of surgery, it gives a clear idea about that. Sorry, SRB's manual of surgery gives a clear idea about that. Please go through that. So students, I again request you to subscribe my YouTube channel to upgrade your surgical knowledge, and also have my manual of surgery, SRB surgery and clinical method surgery to have an entire idea about the surgery. Students, go through the MCQ and put it in the comment box. I acknowledge you for that. Tillow's triad is seen in acute appendicitis, choledochal cyst, mesenteric cyst, ovary cyst. Put the right answer in the comment box. I'll get back to you. And another MCQ is total possible score in peritoneal carcinomatous index is 13, 26, 39, 52. Put it in the comment box. I will give the answer later. Again, request you to subscribe my YouTube channel, which is free, to increase your surgical knowledge. The mainly case scenario, images, instruments, and I will also join live sessions once in regular intervals with the case discussion for 1.5 hours, with not only with me, with the senior faculties from different places of the country, with the interactive session. You can always put your questions in the chat box and get your answer, and you will get a certificate also of attending the live session. So request all students to join the session so that you will have the upgrade your knowledge for the long case and other cases in detail and extensively. So again, I request you to join subscribe my website and have a better knowledge about the surgery. Quotation of the day is: a good relationship, correct each other in private, defend each other in public. So if you are a good friend, they correct you in private, not in public. And in public, you will defend you. Even if you are done the mistake, they will support you, say it is okay. But in private, they will correct you. What you have done is wrong, but get rectified. That is exactly the meaning of this one. So students, please go through my SRB's manual of surgery. It gives detail about all CBME syllabus and covers both for MBBS and postgraduate also. But we got MCQ for each topic wise: general surgery, gastroenterology surgery, urology, specialty basics, urology, neurosurgery, cardiothoracic, all those basics are covered. Instruments, adjuvant therapy, chemotherapy, briefly about anesthesia, specimens, briefly about anesthesia, briefly operative surgery, and current recent advances also. Everything covered with the quotations, with the illustrations, with the photos. Everything is covered. It's more than sufficient for undergraduate to go through this book, learn surgery, and face exam, place MCQs, everything for both UGs and postgraduates. Also go through my clinical methods in surgery with the video of how to examine in each topic. It gives a detailed examination method, but of course there is no management in this. It's a clinical book, and briefly in a tabular form, differential diagnosis, and good photos, and exactly how to examine and how to write case sheet of each different topics: ulcer, swelling, breast lump, and everything covered. Briefly orthopedic also. It also has got specimens, images, instruments, which can always be useful when you take Viva and Oxy and practical exam. So very, very useful, because we have all videos of how to examine a patient. It's very, very important in your practical exam of any medical graduate of any type. It will be very, very useful. So please go through it and have it. And my operative surgery, the 2-volume book, new edition has come, and it was extensive discussion about the methodology, technical principles, and steps of the different operations, major to minor. Everything is covered with around 10,000 illustrations and photos. And my tissue atlas of tissue approximation, small 100 pages book with the video, how to do suturing in different situations properly with the video. It has shown very well, and can always go through that. And my DigiNow lectures through JP Publishers, around 220 hours, covers everything, A to Z topic, urology, specimens, instruments, clinical examination, videos, everything it is covered. Please, you can purchase for a year, so that you will have the clear idea. You can face the exam, have the clear idea, academic part, everything. You will have entire subject is covered, including clinical part. So please purchase and have a clear idea about subject and to face the. So students, I hope you have understood this lecture very well. Thank you so much.